Minister of Health Dr. Frank Anthony, in delivering remarks at the opening, explained that the purpose of the workshop is to ensure that standard protocols across the country are equal when it comes to the point of care.
The things that we have in place, these are what we're going to be using, this is how we're using, these are the triggers that will go from one stage to another, this is how we move from stage, let's say the asymptomatic phase to a milder phase to a more moderate to severe to critical and so forth. And what are those triggers? And as we move from one phase to another, what are the ideal treatment that we should be using? So it's very important, and I think in these guidelines, they have really broken it down in that way.
The minister further explained that the management of COVID-19 patients is complicated, as every patient is different, and this has to be taken into consideration when offering treatment.
There are a couple of things that we have also noticed, and that is you have persons who would have a longer form of COVID. So instead of them, after say 20-something days, we can probably discharge a person, people would continue to have signs and symptoms of COVID, whether those are neurological or other forms of symptoms, and they're there. And so we have to think about how we manage those patients even after we discharge them. And so that too is a very important component, and we have to look at the management and what we can do for those patients.
Anthony added that in about a week or so, Guyana will be sending 180 samples to the Aishan School of Medicine at Mount Sinai in New York to conduct research on the ministry's behalf.
One, those cases of persons who have died because they got the more severe form of the disease, to see whether or not the strains that they were infected with is the regular strains that were circulating, or whether it's something else. And those who got reinfected, to see whether or not it's one strain or it's different strains. And then we have looked at a sampling of persons who were infected around the border areas. So samples coming out from 9 and 8 and so forth. We have taken some samples and we are going to send it up to do the sequencing to get a better understanding. As you know, of recent time you had the strain that was discovered in the UK, then the one in South Africa, and then the one closer to home here, the P1 strain in Brazil. And outside of that, over the last week, in the United States alone, they have come up with about 3 or 4 different strains that they have identified. So the mutations are there and it's occurring. And what is important is that even with some of the medications that we have, because of the changes that are happening with the spike protein, that these things can actually evade our immune response. And therefore, we have to be able to understand what is going on with the strain, what are the mutations, how this is operating, and what are the consequences of those mutations. And if we can understand that, it then gives a better perspective on how we can treat.
As of Tuesday, March 9th, Guyana's overall number of confirmed COVID-19 cases was 8,847. To date, 8,200 persons have recovered, with Guyana's total number of deaths standing at 204. The latest death is a 76-year-old man from Region 10, Upper Demerara Berbice, who died while on his way to a medical facility on Monday. Meanwhile, on Wednesday, the Ministry of Health commenced countrywide COVID-19 vaccination for persons 60 years and older. The health minister reiterated that it is not mandatory to take the jab and noted that frontline healthcare workers who were being vaccinated first will not be penalized for not taking the vaccine. For persons 60 years and over, they can visit health centers or immunization centers in their area and present their national identification card before being administered the vaccine. For the newsroom, I am Danielle Swain.